GMA cover story, and the drugs being used for weight loss like Ozempic are making headlines again. ABC News medical contributor Dr. Darian Sutton is here with a reality check. Good morning, Dr. Sutton. Always love having you. So there are reports of people experiencing so-called stomach paralysis. What is that, and what should we know about these side effect claims?
So good morning, Janae. So stomach paralysis associated with these medications, Ozempic and Wegovy. So one of the methods that these medications work is that they slow the rate at which food empties out of the stomach, or they have something called gastric delay. This helps with feelings of fullness and helping to suppress appetite. Now we're seeing these isolated reports of patients who are suffering from stomach muscle paralysis, where food cannot empty out of the stomach. We define this as called gastroparesis, and it can be associated with symptoms of abdominal pain, bloating, acid reflux or GERD, and severe nausea and vomiting. And Janae, I've taken care of patients who suffer from this diagnosis. It is absolutely brutal. Patients often come in with severe dehydration and electrolyte abnormalities, and many have their symptoms are so difficult to control that they have to be admitted to the hospital. But in the larger studies, we have not seen an increased rate of gastroparesis comparing those who use these medications to the general population. So we'll still have to wait and see if there's any identification of cause and effect, but I think it's important to acknowledge.
Yeah, important information there. On a different topic here, there's also an investigation into a potential link between these drugs and suicidal thoughts. What can you tell us about that?
Well, in Europe, between the years of 2020 and July 6th of this month, we've seen increased reports, at least 5 confirmed cases of patients who are reporting these thoughts of self-harm and suicidal ideation. Now, again, similar to gastroparesis, in the larger safety profiles, we have not seen an increased rate of these findings when we're comparing the patients who use these medications to the general population. But the investigative probe is expanding on this because this would not be the first time we've seen diet medications associated with thoughts of self-harm. For example, certain oral medications confirmed and approved in 2014 have been labeled to have an increased risk of thoughts of self-harm. So I think it's really important to acknowledge this, especially if you have a personal history or an increased risk with your provider before taking these medications.
So, Dr. Sutton, what is the bottom line here?
The bottom line is these medications are wonderful. They can have wonderful effects. They can reduce weight. They can help protect against diabetes and reduce cardiovascular risk factors. But overall, I would advise that patients acknowledge these possible risks so that they can make the best decision for themselves. They are not to be taken as simple over-the-counter medications, and they are not to be seen as medications that can be a simple fix. I would advise that patients review these possibilities with their provider and their personal history to make the best decision for them.
So well-versed. We love when you take a break from working in the emergency room to chat with us, Dr. Sutton. Appreciate you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.